I think it's wrong to close the access clinic. The dentist for the special needs children and community is absolutely vital around here, and to save a few pennies is wrong.
Well, I don't know they should be closing any services. We definitely need dental access centres and places we can get to that are handy, have got parking and that people can use. The services are stretched enough, so we don't want any more closed. Keep them open. Thank you.
I think the petition speaks for itself with 5,655 signatures that people have signed the petition to keep it open.
And why do you think it is so important for the community?
So many people use it. They tried to say a few years ago that nobody was using the centre. I've been there a few times myself, and it is always full, with people waiting.
Yeah.
And as I said previously, if it wasn't there, things that are what is classed as minor ailments, the people would revert back to A&E. And also the pressure on the GP surgeries, where I have found that quite a few of the surgeries are having to tell their patients they can't see them for 2 to 3 weeks at a time.
Yeah, basically I think it's a really bad idea that they're trying to close this place down because there's so many people that need it. I mean, it's always busy inside. You know, like myself, I've been waiting here for a while now, but you know, I'm here because I need it. So I think it's a bad idea that they're trying to close it down.
And just because I'm not a councillor anymore, it doesn't mean to say that I don't support my community, because I do. I haven't forgot my community,
No,
and that proves it.
We need to convince you that this is better for your community. And if we
Yeah.
can't do that, we won't close the walking centre.
Yeah, well, good. Like a splay.
Yeah.
Except they don't want to splay.
Gary emailed that, on working on it, so I got back to it.
Shall we?
Yeah. We're here today, so we're going to take a more relaxed approach. We are going to go through the formal presentation just to bring everyone up to speed and before the proposal. So, welcome today to this consultation event on primary care services in Herefordshire. My name is Stephen Williams, and I'm the event facilitator for today. So, I'm going to quickly go through today's structure. So we will follow this, so make sure that you're able to give your feedback and your views and opinions on the walking centre and the proposals being put forward. So, first I'd like to introduce the panel. So we have Hazel Brown, Director of Operations, Dr Dominic Horn, Clinical Vice Chair, and Dr Ian Tait, who's the Chair and Clinical Lead of the Commissioning Group, Simon Hairsnake, the Accountable Officer, and, sorry, I've only just met everybody here today, Leslie Wokes, Director of Primary Care. That's not entirely sure how So, I'm going to start off with Dr Ian Tait, who's the Chair of NHS Herefordshire CCG. He's going to do a presentation. So, over to you.
Welcome, and it's really good to see you here today. I see that the numbers are sparse at this moment, but I'm sure, as you probably realise, there are a number of other events, and I'm expecting there to be much more attendance in the evening when it'll be easier for people to get here. But we wanted to have a spread of times to make it as accessible as possible. So thank you for giving up your time to be here on a very, very important topic. I just want to give you a little bit of intro about what the CCG is and why we're standing here today having this conversation with you. So if we could just move on. Basically, going back to some reforms of the NHS a few years ago, the plan was to have GP practices and practicing clinicians as part of the system that planned, organised and monitored the care for patients. And that was because GPs have huge numbers of contacts with patients, both individually, but also through the GP practice in which they're working. The figures, interestingly, have gone up a lot recently. So as recently as 5 years ago, the average patient had contact with their surgery about 4 times in a year, And over the last 5 to 7 years, that number of contacts has gone up to roughly 6. So there's actually been a large amount of extra work happening at the practice level. And that's why we think it's very important to keep clinicians involved in working with patients and their representatives and the population to deliver the care that we would all expect for our own families. Basically, in Herefordshire as a whole, and for those that know me, and some of you will know me, I'm actually a GP in Bromyard in the northeast of Herefordshire. It's a small market town, but I have a long attachment to Herefordshire, having actually just been in practice here now for 29 years, and I have contacts with all the GPs in all parts of the county, and very specifically in the city. And in fact, my own background is my father was a city GP in Nottingham for almost 40 years. So in inner city Nottingham, a place called Radford. So I have a lot of contact with both urban, suburban and country practice. So my background is not just in what you might describe as leafy Bromyard. It's across the entire general practice population. Herefordshire as a population is really interesting in the sense that we have what may look like a large number of people at 187,000, but actually in county terms, that's a very small population, and that brings with it issues of the actual mix of our population in terms of ages, and also where people are to enable them to access the services that they need. And as you can see from some of the figures there, that our older population, and I'll shortly be in that older population personally, so it's certainly not a derogatory term, actually is higher than the national average. Our under fives are an interesting group because they've been going down, but actually recently they've started rising again. And it's very important because the two aged ends of the scale are those that need the most carefully planned services, and it's really important that we make sure that their needs are met. And that's very much, a lot of that work is in primary care. Also, obviously, we've got some very quite different geography across the county. Hereford City has roughly 35 to 40% of the population of Herefordshire, either in the city or within a mile or two. We've then got a ring of market towns, and then beyond that we've got actually a very, very rurally isolated community. And what we're trying to do as a system is to provide care closer to home wherever possible, but that's across quite a complex geography. And 25% of our population are most deprived in terms of geographical barriers to getting access to service. And as you can see, our financial footprint may sound a lot of money, 230 million, but if you were in a city the size of Birmingham with a population of 1 million, that figure, if you scale it up, would be in the billions. So it sounds a lot, but it isn't necessarily. So basically, just to summarise that, our population is small. We've got the dispersal factors we've talked about. We do talk about age. Actually, I think age is an advantage because actually there are a lot of skills out there, and many of the support services, be they in the voluntary sector or elsewhere, are actually provided by people who are in that retired or supposedly older group, and actually they're very active contributors to society. So I think the whole age set needs to be reset because, to be quite honest, there are people who are living and getting on with a very active contribution to society well into their 80s. So I think the concept of age is very relative these days. But as people live longer, there is sometimes more complexity in the number of problems that they're facing and how those interact with one another. So if you have one problem, a medical problem, it might be relatively easy to talk about what we do about it. If you, over time, acquire a number of medical problems, the individual treatments that help them may help one problem but make another one worse, and therefore our factors of trying to manage those complex diseases and patient experiences become more complicated. It's very important that we plan for that. And then looking at the way Herefordshire is configured, obviously, as I hinted, our finances do look big in number terms compared to an ordinary household budget, but actually compared to other NHS commissioners, i.e. people who plan and purchase care on your behalf, actually they're relatively small. And to try and cover the complexity of our setup, we have to make decisions about what we do more and less of, and that's the normal pattern of commissioning. But in general, what we try and do is get the best footprint we can for the entire population of Herefordshire, because that's what we're here to do. And we are, you know, I can't speak for every single person here. I am a citizen of Herefordshire, and whatever services are out there, myself and my family will be experiencing. This is not some academic exercise. This is about me and my family as well. And all of that requires working with other people. Individual clinicians, doctors, nurses, physios, and others are working with individual patients. And obviously we also work with organisations of patients, and we also work with communities. And obviously it's very important that we're working with people both within a particular house, a particular street, a particular area, and I'm grateful that we're here in South Wye, which is an area that we need to make sure has a proper pattern of services. And then beyond that, we're looking after, obviously, Hereford City and the wider population. So there'll be lots of opportunities to talk about this later on, and I would like to pass on to Simon, who will take you through some of the other information for the presentation. Thank you.
Thank you, Ian, and good afternoon, everybody. So Simon Haresnake, I'm the accountable officer, or the chief officer of the CCG. So I'm just going to run through specifically the proposals that we are putting forward as part of the consultation process, why we're doing this, why we are putting these proposals forward now, the benefits which we think they're going to bring to local people, and take obviously questions later. So we talk to people, we listen, we try to engage, we have a close relationship with Health and Wellbeing Board, Health Overview Security Committee, Health Watch, Paul, Chair of Health Watch has just come in. And when you ask people what sort of health service they want in Herefordshire, you get a pretty consistent answer. And it's not really any different to the sort of health service that people want everywhere in the country. They generally want care at home or close to home. They want good access. They don't want to go to places unnecessarily. They recognise the importance of general practice. It's your general practitioner that is the bedrock of the NHS. It's your general practitioner who provides continuity of care, and it's your general practitioner that enables you to access all other health services, or practically all other health services. So GP, being able to get to a practice with the right staff to treat your needs is really important. Generally, people want to be supported to look after themselves. They recognise they don't want and don't need unnecessary treatment. They very much want to make sure they're in the right place at the right time for the right treatment. So they want to be clear around signposting and access. And they want to be involved, you know, the old no decision about me, without me, co-production tends to get used. It's when you're designing health services, whether it's for you personally, or your family, or your community, involve people. That's what people want, and indeed that's partly what this afternoon and these sessions are about, genuinely involving people. And I'll say it again, I'll keep saying it again, this is a consultation exercise. No decisions will be made until the consultation exercise is completed. Everybody involved has got a right to express their views, whether it's by email, telephone, petition, attending these meetings. Everybody will be listened to, and at the end of the day, the governing body will make an informed decision in public about where we take this forward. So we've got some proposals we're going to share with you in a minute. We think these proposals are a direct answer to what people have told us. They focus on GP registration. They simplify complex systems so people can get to the advice and treatment they need appropriately. And it's also around supporting healthy lifestyles, because we bluntly know part of the wider debate, the NHS needs to change. We need to support people more to look after their own health. Very different sort of healthcare needs now than 20, 30 years ago. So why we need to change? As I say, that listening exercise has told us three things really. It's told us that we have a very complex system. It's too complex. At 6:30 on a Wednesday evening in Hereford City, you could have a choice of 7 different services: 999, NHS 111, A&E, the out-of-hours service, your practice, the tourist hub, or the Hereford facility next door. It's too confusing, and it's not surprising that people end up in the wrong service at the wrong time. So we need to simplify it and make it clearer for people about which service they need when they need something. We want to really focus on GP registration being the bedrock of the NHS. If you're not registered with a general practice, you're not getting the services that the NHS needs to provide to you and you need. And if you can't get to see your GP, there's a problem which we need to fix, because everybody should be able to get to see their GP same day if it's urgent, or within a reasonable time frame if it's less urgent. So we also, the last 2 bullet points, have to do something now. Not doing anything isn't an option. The current contract runs out, and therefore we would have to do something anyway. This is the opportunity now to think about, do we simply renew the contract, put it out to tender, decide on somebody who wants to run, if anybody wants to come forward, and run a service like the one now we have now, or is it the opportunity to make some changes? And finally, we have a new GP out-of-hours service and a new NHS 111 service in place at the end of last year, and again, where these proposals fit in with that new service. So the other important point, and it's been a long-standing issue, certainly since I came to Herefordshire in 1999, is that we know the South Wye area has the greatest need and the poorest access to healthcare. Demographically, it's got the greatest need, and you know the practices, Belmont and the Ross Road branch, all the other practices are north of the river. So for a long, long time, Ian and I, others, have been trying to find a way where we can expand primary care services in the South Wye area, south of the river, and this is the opportunity to do that. So specifically, most of you will know, I expect, there is a small branch surgery in Ross Road of the Moorfield House surgery. It's not particularly good estate, car parking's not great, and we've been looking to relocate that branch surgery for at least the last 15 years. I can remember a debate in the early 2000s about when this place first opened, that it was possible and it didn't happen at the time. But we've got the opportunity now. That will allow the practice to register more people locally and provide that high quality continuous healthcare needed by people and can only be delivered by registration. We're also going to strengthen services in the South Wye by relocating the service that's provided by Taurus Healthcare, which is the collective federation of practices in Herefordshire. So we're going to move that facility, which currently is in St Owen Street, which provides care in the evenings and 8 to 8 Saturdays and Sundays, down to the facility as well. And we are going to go no stone unturned with trying to make sure people are registered. People who aren't registered, at the moment, 96% of the people who use the walking centre are registered with a GP, and we need to make sure they get to see their GP, because that's how you get the best healthcare. A small number of people aren't, and it does tend to be those most in need and sometimes most vulnerable who, for particular reasons, can't access or can't register with a GP. We think that's not good enough. We need to get everybody in Herefordshire registered with a GP. So that's our core proposals. So very much around everybody has access to a GP 24/7, whether it's your registered GP or through the extended hours of service or through the out-of-hours service. We want to really make sure everybody has got the ability to register, and we'll really make sure that happens, and not just being registered, but making sure that the practices are giving the right number of appointments so that you can get to see your practice if it's urgent on the same day and within a reasonable time frame. It's around continuity of care. One of the problems with the current arrangements next door is that the service there does not have access to your health service records. They are blind. They see you, they come in, they make a decision. It's so important now around the continuity of care, people with long-term conditions. It's so important that people, the GP seeing you has access to your clinical records. And in the new arrangements, whether you're registered with Moorfield House or you're coming in the evenings at weekends, your records will be there, so people will be able to make decisions around better decisions really. So that's largely it, isn't it, from me? We are changing the nature of the facility. The lights will be on, and the facility will be providing primary care exactly the same hours it is now, from 8 o'clock in the morning to 8:30 in the evening, and from 8 to 8 Saturdays and Sundays. There will be more primary care delivered in that facility, in the Primary Care Access Centre. We'll be spending more money on primary care in that facility. Won't be saving any money on in that particular site. We're doing it because we think that making appointments with a GP who has access to your records is a better way of healthcare being delivered, rather than people having to wait there for 45 minutes or an hour and then access a GP who doesn't have your records. The walking centre is bluntly a sticking plaster on a problem, and the problem is making sure that people get good quality access to see their GP, and that's what we want to do. Okay, so I'll leave it there.